Implantation cramping. Your cramps may not be the usual menstrual spasms as you think. It may be one of the earliest signs of pregnancy known as implantation cramping. Implantation bleeding may well be considered a fairly common indicator that a fertilized egg has taken a hold onto the walls of the uterus, and the woman is well and truly pregnant. However, where implantation cramping comes on the radar, we may comment that it is not a concrete symptom of pregnancy, but it may serve to be a partial determinant. Few women actually feel the discomfort due to implantation of the fertilized egg into the uterine cavity. Implantation cramping sometimes is accompanied with slight bleeding as well. Thus, it is often confused with menstrual cramping and bleeding. It is actually a good sign, for it signals pregnancy. Strives to clear all the doubts that women may have about implantation cramping and bleeding and the unfortunate compatibility of its symptoms with menstrual cramping. When does implantation cramping occur? As mentioned earlier, women, though not all, experience cramping when an implantation takes place in their womb. Since implantation occurs about 6 to 12 days after ovulation, cramping should take place around the same time, when the newly formed fetus, technically called the zygote, gets attached to the uterine cavity. Normally, a form of dull cramping takes place, being marked as the earliest possible sign of pregnancy. It is usually not noticed after the pregnancy is confirmed. One may say that implantation cramping is nature's whisper to let the mother-to-be know about the pupating life in her womb, way before pregnancy tests and other scientific instruments were invented for the same. Thus, one may conclude that contrary to the common reactions of disappointment, worry, and stress, implantation cramps may be welcomed with happiness, anticipation, and maybe a little nervousness. Are cramps always associated with the act of implantation? A clear-cut answer would be no. There, sure is a possibility that the cramps share a relation with implantation, however, it is not reliable enough to confirm pregnancy. Cramps may serve to be viable supporters, or contributors in signaling implantation, but to concretize this, the probability will have to depend on mediums, such as pregnancy tests and symptoms. You cannot base the onus on implantation cramps alone to confirm pregnancy, as the egg, when gets fertilized, is microscopic, and its propensity to affect the uterus may be considered negligible in nature. Hence, you may, or may not endure cramps during implantation. How do women understand it, indeed, is implantation cramping? The concept of cramps may have women shake like a leaf. For one, it is a situation that makes women a tad wimpy. Some may be faced with heavy cramps, while the others may hardly experience any. Know that implantation cramps occur during the first trimester. With implantation cramps, there may be an occurrence of spotting. This, generally, is the period when women are not sure if the cramps signal a potential conception, or is it an overture to their menstrual cycle. The symptoms of implantation cramps crop up as a simmering ache in the lower abdominal region and pelvis. This slight pain begins when the implantation of the fertilized embryo takes place on the uterus wall. The intensity of the cramp varies from one woman to another and can be anything from mild to strong pangs of pain. Also, the body starts adjusting to the pregnancy hormone levels, and this causes mild discomfort and cramping. The problem with identification of implantation cramps for what they are? Not everyone experiences them, and even those who do, instinctively put it off as some routine menstrual cramp, only to be surprised, or shocked, as the case may be, later. Can you have implantation cramping around the same time your period is due? Yes, it is quite possible to experience implantation cramping as well as bleeding around the same time your period is due. This is one of the main reasons women get confused between possible pregnancy and menstrual cycle. If the bleeding and cramping lasts just for a day or two and is not as heavy or painful as your menstrual cycle, it probably means you are pregnant. How far is implantation cramping and bleeding considered common? Implantation bleeding is quite common an occurrence, and some women do experience it during the onset of pregnancy. If spotting takes place before your monthly cycle begins, there is absolutely nothing worrisome. It probably is a sign of pregnancy. Spotting is just coming across a few tiny brown-colored spots on your panties. For some, it may be slightly more than spotting, but not the kind of bleeding they experience during periods. However, if the bleeding is heavy and resembles your regular menstrual blood flow, it, indeed, is not implantation bleeding. Can implantation bleeding occur when periods are around the corner? Remember, if you notice spotting when your menstrual cycle draws near, the chances of it being implantation bleeding are slim. Also, the color of blood is a determining factor. If it is fresh blood, it is unlikely that the blood evicted shares affinity with implantation bleeding. The blood would be dark brown to an extent of bordering on black. Why? You may ask. You see, the egg moves through the fallopian tube down to the uterus from the ovary and gets fertilized by an available sperm. The fertilized egg is then implanted in the endometrium rich in blood and several nutrients. Now, if the implantation does not occur, the endometrial lining is shed. This is what we refer to as menstruation. If implantation takes place, the lining is shed at the time of parturition. During implantation, a few drops of blood may escape the lining and trickle through to the vagina. This is known as implantation bleeding. The process and time it adopts to make its way out of the body brings about a tendency of it being referred to as old or aged blood, hence the brown color. How long does implantation cramping last? Implantation cramping should ideally be slight and brief. In simple words, your cramping should not last for more than a day, with a maximum of 2. If your cramping does not align itself with the things mentioned above, that is, if it is severe, or it has lasted for more than 2 days, you need to see a doctor for some tests to rule out a miscarriage. Other problem areas that need to be checked for include the chances of ectopic pregnancy, preterm labor, placenta abruptio, placental abruption, preeclampsia, and urinary tract infection. If you have eliminated the possibility of all the above, you can rest assured that it is just gas and bloating that is causing the feeling of a growing uterus, along with the symptoms. Do women have to expect implantation cramps and bleeding during their next pregnancy as well? There is no such rule of thumb that you would experience cramps during the first trimester of your second pregnancy. If you did go through cramps during your first, chances are you may, or may not go through cramps and bleeding while preparing for your next. What could be done to alleviate cramping? Mentioned herein are helpful curatives to provide relief. A hot compress works well during these times. The part is bound to feel anesthetized at least for a while. A warm water soak is sure to relieve you of the pain. Keep your system hydrated. Lack of water is one of the noted factors that causes constipation, especially during the first trimester. Rest well. Bask in plenty of sleep. If you will, try meditation, or yoga. However, a word of caution. Practice yoga only after consulting your healthcare guide. If you feel things are not improving after investing all the effort, your healthcare consultant would be happy to help you. When should you take a pregnancy test after implantation? It depends upon the type of pregnancy test you're opting for. A blood test may confirm the pregnancy 2 to 4 days post-implantation, or 9 to 16 days after ovulation and fertilization. In case of a home pregnancy test, HPT, wait 2 to 3 days after the blood test to increase your chances of getting a positive result using HPT. Also, it is advisable to take a home pregnancy test on the first day of your missed period. If the results come negative, take the test again 1 week after your missed period. However, note that the outcome may vary from case to case, as there are various factors that affect the detection of pregnancy. Kindly consult a trusted doctor for accurate assistance. I hope I have sufficiently filled you in on the symptoms of implantation cramping, how long does it last, and other such pertinent information. If you experience implantation bleeding or cramping, you must not hesitate to speak to your doctor in order to clear your doubts.